All right, good afternoon. I'm joined today by Melissa Samuel, who's the president and CEO of the Healthcare Association of Michigan, this state's nursing home association, and Mohammad Qazi, who's the CEO of Ciena Nursing Homes. And they're going to join Denise Fair and me to talk about what we are doing in dealing with the issue of nursing home patients in the city of Detroit, and they can talk more broadly in the state who have been exposed to COVID-19. As far as our updates today, all of the numbers are heading in the right direction. We now have lost 733 members of this community. And that's only up 17 from yesterday, which is one of the lowest numbers that we have seen. But as you know, I don't react too much to one day's numbers versus another's. I'm more interested in the trend. The overall trend looks good. But when you look at the hospital data today, all of those numbers coming out of the hospitals look good. We've seen the fewest number of occupied critical care beds in Detroit that we've seen since the start of this. We've seen the fewest deaths in hospitals. We've seen the fewest deaths of ventilator patients in hospitals yesterday. And so those numbers are very encouraging. And I was over at the TCF field hospital today, and they only have 17 patients. They had the Secretary of the Army in to inspect it, and we consider it a sign of great success that they've got 983 empty beds. The other thing that was really interesting yesterday is the Detroit Police Department. I am hearing from groups around the city about the rapid response from the Detroit Police Department on the calls, and yesterday the priority one response time was 9 minutes and 30 seconds. I think that's the lowest response time we've had in many, many years. 12 minutes was the goal that we were shooting for a year ago. And so DPD continues to come immediately upon request, and it's made it that much easier to keep the crowds from dispersing. A couple other things that I want to talk about for our employees. If you are involved in critical infrastructure, for the most part, we have not had our critical infrastructure employees at work. We were allowed to under the governor's order, but I did not want to bring folks in until I was confident we had the absolutely appropriate medical protocols in place. And in the near future, you're going to start to get phone calls if you haven't already. So those who are repairing the potholes in our roads, those who are fixing our water and sewer system, those who cut the grass in our parks, clean up the illegal dump sites. We are going to start to make plans to bring our critical infrastructure staff back. Everybody will have to be tested and test negative before we will bring them back, and Dr. Dunn is going to have the most strict medical protocols in the country for our workers, making sure that they have every protection available. And so those communications are starting with the union leaders, but if you've been driving and you hit a pothole in Detroit, I know we're behind, but we're going to get folks back as soon as we can safely bring them back, and I don't think it will be too far away. As far as the nursing homes, we now have tested 3/4 of the residents of our nursing homes, more than 1,400. They are coming back 25% positive, and we will be through every nursing home resident by the end of the day tomorrow with our 15-minute tests. And we are seeing the nursing home community respond as we had hoped. As we've talked about before, there are so many COVID-19 positive people in our community who aren't showing symptoms that it was virtually impossible to separate in a nursing home setting the infectious from the non-infectious. You had no way of knowing without a test that probably wouldn't come back for 5 or 6 days. Now that we have been able to go through and basically in 10 days test all 2,000 people, we are seeing the nursing homes do what we had hoped, setting up separate COVID-19 areas, isolating patients the way they should, and I feel like we are seeing the kind of partnership that we should see. And now with the CDC here, we've got even additional staff. And so Melissa Samuel and Mohammad Qazi are two of the leaders in the nursing home community. They had been asking for help for some time, and I'm really pleased with the partnership that we've had. And I wanted them to have a chance to talk about what they're doing and be able to answer questions about this, because I know there's a lot of concern about loved ones, our parents, our grandparents in these nursing homes, and the question of whether everything possible is being done. With that, I will turn it over to Melissa Samuel to talk about how the nursing home community is dealing with these very real challenges.
Thank you, Mayor Duggan. I am Melissa Samuel with the Healthcare Association of Michigan, representing over 350 nursing facilities in the state, including most in the city of Detroit. We would like to thank Mayor Duggan for his leadership during this crisis. His focus and work with nursing facilities in the city to fight COVID-19 has undoubtedly saved lives. The efforts to flatten the curve have been nothing short of heroic. We owe a debt of gratitude to our direct care workers on the front lines of the pandemic, serving our most vulnerable. We understand these are your parents and your grandparents. Because Mayor Duggan made testing a priority, we are now armed with the necessary information to stop the spread of the virus in nursing facilities. The mayor has established a template for the rest of the state on how to best fight the virus. Testing is vital, along with PPE and staffing. We are united with the mayor, our healthcare partners, and the state to do everything necessary to protect the residents and staff in our buildings.
All right, and just a few months ago, I was over at Mohammad Qazi's opening of his beautiful nursing home over on Verner, and it was a day of celebration. We never imagined we'd be in the middle of this situation just a few months later, but Mr. Qazi has been somebody who's always been committed to the highest quality of care for his residents, and I want him to talk about some of the challenges he's facing and what he sees happening as a nursing home operator in the city of Detroit, and really one of the largest in the state.
Thank you, Mr. Mayor. Good evening. Good afternoon, I'm sorry. Being as one of the larger provider in the state of Michigan, and we have a fairly large footprint when it comes to the nursing homes. And in the city of Detroit, Ciena owns and operates about 7 nursing homes. And the one that Mayor Duggan just talked about is just a stone throw away from here, is called Regency on Shane. This is one of the 7 buildings in Detroit. COVID-19 has been, you know, everyone knows, and we're painfully aware of the fact that it has been a huge crisis in the community. Being in the nursing home, we're dealing with the population that is the most vulnerable. It's the elderly, and they have the underlying conditions. The challenges, I believe, have been pretty evident. Everyone knows that testing has been a huge challenge. And then as far as, other than that, the staffing and the PPE, these are the 3 challenges the nursing homes faced. 3 weeks ago, there's no secret that there was hardly any testing getting done. The staff was nervous. They were scared. And it is difficult for me to ask my staff to put their lives on front line. And we can't make them do it, yet they did it. So I'm very proud of the healthcare workers. I know that overwhelmingly the hospitals are the ones, the healthcare workers, the physicians and the nurses. And God bless them, they really stepped up and risked their lives, and some of them lost their lives. Same can be said in the nursing home setting. People have risked their lives, and they are risking their lives. What's really changed now in the 3 weeks is that there's more testing available, and we're very fortunate in the city of Detroit. It is the only major city in the country that was able to have the 15-minute rapid testing available. We reached out to Mayor Duggan when we heard about this good news, and we were very fortunate that he honored our request and felt that the need was definitely there. He realized that this is the vulnerable population that we need to really focus on. This is where this crisis is going. This is where this war is going. So since then, in the city of Detroit, which makes it very unique, that pretty much all the nursing home residents, 75% of them been tested. The Salmon Ciena facilities, I believe, will be done by tomorrow, testing all the residents. And as a matter of fact, the city also offered testing to our employees, which is critically important as well, because we certainly don't want our employees who are asymptomatic showing up and potentially infecting our residents. The other big change that has taken place, we've collaborated with the state of Michigan and also with the city, is to create these units, COVID units. So for example, the facility that we just talked about, Shane, the first entire floor is dedicated to COVID patients. Because until and unless we can test and isolate the COVID patients, it is potentially a dangerous situation, because then you have other patients, other residents, guests who can potentially be infected. So this is another significant improvement or change on the ground that has taken place. Ciena's, we have about 6 buildings here in the Metro Detroit area that have now COVID units, where either it's one floor or part of one floor, maybe 25, 30, 40 beds. So that is, again, a big change. The third challenge has been staffing. Now that there's more testing done, that we can isolate, we can dedicate staff, provide dedicated staff to the COVID positive patients, the employees are starting to feel better and secure. And on top of that, we've been very fortunate to secure a lot of PPE, masks, gowns. As you know, all of you have heard, there's been a huge shortage. But we've been very fortunate to secure quite a bit of PPEs. So I feel very comfortable today, as I sit here with the mayor, that I think we're really, we do have challenges. We still have staffing challenges. That is just a fact of life in nursing homes or in healthcare to begin with. But I am sure that with the resources that we have, that we're already starting to see some very positive changes taking place. It is a long haul. We will be in it. We are going to need more resources and more help. But certainly we're making progress.
Thank you. One other subject I want to touch on before I turn this over to Denise Fair, and that is the essential employees testing program at the fairgrounds. We have now approved 200 companies who have 10,000 employees to go ahead and get tested at the fairgrounds without a prescription. And I want to go over again the process, because I know this is new. But here's what happens. When the company calls up, your company is given a code number. As a company, you have to give the code number to your employees, because the employees book their own appointments. And this is a little bit maybe difficult to understand, but it's important, is that the HIPAA privacy laws do not allow us as a city to tell the company about your employee's medical circumstance. So the employee has to book his or her own appointment. The employee is going to get the results directly from us, and then it'll be your responsibility to get your information from your employees. But the employee has to make his or her own appointment. And so I would say to the 200 companies, I know this has been explained, but I want the employees to understand as well. Get your code number from your employer. Call the Quicken hotline. Book your appointment yourself. We've got spots tomorrow. You can call up right now if you've got your code number and book 4 o'clock tomorrow afternoon. You can book 9 a.m. Saturday. You get your code number. You can call and book your test right now. And so I do want to get every essential employee who's working. If you're in a job that requires you to leave your home and go to work in the city of Detroit, your company can get a code number and you can get tested. And that's what I want to do. Everybody that's got to leave their house and go to work to serve the rest of us, I want you to be able to be tested and be sure that you are negative for COVID-19. I'll make one other point. Tomorrow we will be doing this at 11 a.m. We've got a very special announcement that I think is going to be of enormous interest to the people of Detroit, and we're going to be doing our briefing tomorrow at 11 a.m. to accommodate the individuals that will be here. So we won't be here at 2, we'll be here at 11. And with that, I'll turn it over to somebody who's been spending a lot of time in the nursing homes, Denise Fair.
Thank you, Mayor. So the Detroit Health Department continues to partner with our seniors and our staff in the Detroit nursing homes. And Mr. Qazi and Ms. Samuel, and also all the nursing homes, have been a wonderful partner in this effort. Our goal is to diminish the further spread in these communal living facilities where viruses like COVID-19 can thrive and place seniors and workers at a higher risk. So here's where we are as of today. We have now administered 1,445 tests in 21 of our 26 nursing homes throughout the city. We have confirmed 357 COVID-19 cases with an infection rate of 26% and 129 deaths. We remain on track in our 10-day goal to prioritize our seniors and expect to be completed by end of day tomorrow. I just want to thank our city's first responders, our medical students from Wayne State, as well as our Henry Ford clinicians for helping us with this effort. Once completed, we will turn our attention towards our long-term facilities. This is our skilled nursing facilities and assisted living homes, where those living quarters are similar to that of nursing homes, which also place residents and our staff at greater risk for contracting COVID-19. Now, yesterday I had a chance to sit down with our CDC team, and they have hit the ground running. Again, they have given us 4 people to help us lead this effort. In partnership with the Detroit Health Department team, today they are conducting site visits at our nursing homes, providing guidance on our testing strategies to help us further mitigate the spread in these facilities and ultimately throughout our community. So what does this mean? They are helping us take care of our community. Ultimately, less people will be getting sick. So as of today, there are now 8,105 confirmed COVID-19 cases throughout the city of Detroit and 733 deaths. I continue to pray daily for our residents who have been impacted by this devastating disease. If you are experiencing symptoms of COVID-19, as I always say, please make sure you call your doctor who can assess your symptoms. The health department is also here to provide guidance. Feel free to call us at 313-876-4000. And if you don't have a primary care physician, we can match you with over 30 primary care physicians that are now accepting new patients. In addition to hand washing, disinfecting surfaces, keeping 6 feet away from each other, wearing a mask outside, and staying at home, we also need to know who has the virus. I've heard people say that I have COVID-19, but I don't want to tell anyone. I'm here to tell you that there is no shame in having this virus. This virus has no respect of persons, which means this could happen to anyone. Let me repeat. Anyone can get COVID-19. No one is immune, whether you are a celebrity, a politician, a grandparent, a man, woman, or child. This is why we have taken massive steps to ensure everyone who needs a test can get one. It would, however, be shameful if you were not taking care of yourself, especially if you think you may have COVID, because your inaction could have a devastating effect on others. So our website is filled with all the information that you need to get facts about COVID-19. You can visit our website at detroitmi.gov/health. So Detroit, let's continue to have each other's backs. We will not let COVID-19 defeat us. So please stay well, and if you need a test, please reach out. And with that, I'll turn it over to the mayor.
Okay, anybody have any questions?
Good to see you all again. I have questions for your experts here from the nursing homes. Can you tell people in your individual facilities how many deaths you've had in those individual facilities and what they are and where they're located by name and location?
No, we have not, at the association level, tracked that information. The state, just this week, will begin doing that. First, nursing facilities will be required to, on a daily basis, submit COVID positive and deaths as well.
By not tracking that, does that put you in a position where you don't know where your hot spots are?
No, I don't think so. Certainly our members, where there are clusters in buildings, reach out to us for assistance. They notify us, notify family and residents that that is happening. But it just isn't, because it changes on a daily basis, an hourly basis, it isn't something that we've compiled throughout the membership.
While I'm talking with you, and I'll come to Mr. Qazi next, we have gotten several emails and contacts from people with loved ones in nursing homes saying, we're not being kept informed. Our loved one might be moved. They might be moved to another facility, actually. We're not given information, the number of COVID-19 cases in each facility. How do you respond to that lack of information flowing out to families?
Facilities should absolutely be doing that. If there's a first time a COVID positive presents in a building, they should immediately notify staff and families, and that's what we would, again, advise our members to do. And now, through the CDC and through executive order from Governor Whitmer, that will be required now as well.
Are you concerned that once those numbers do start to come out, that individual facilities will be stigmatized as having an unusually high number?
No, I hope not, and they shouldn't be stigmatized, because this isn't. We represent a population that they have 24 skilled nursing care because they have multiple underlying health issues. So it is the population that unfortunately the virus is going to target the most. We live in congregate settings. So when we have the spread of COVID, i.e. Southeast Michigan, we should not be significantly surprised that it does present in facilities. And we shouldn't be stigmatized. We should be held up, and our operators and our workers should be held up and doing absolutely everything they can to prevent the spread, needing the resources that we do, testing and PPE.
Last question I have for you, and then I'll come to Mr. Qazi with the same type of questions. He indicated that you have had some staffing issues. Have you ever been in a situation where a facility had so many workers testing positive, couldn't work, or had the fear of working, that you didn't have enough staff in a facility to get the job done? And if you get to that critical point, what is your backup to make sure the facilities do have enough staff?
I'm not aware of that type of situation happening. Often they will pull from their other facilities. They'll work with temp agencies. That is absolutely happening where we don't have enough of their own workers, so you're working with agencies. We also now are starting to work with the state. They have a volunteer database, individuals in the healthcare profession that have come forward throughout the spectrum of the healthcare workers that want to volunteer where needed, and we are now coordinating and working with the state to connect that list of volunteers up with facilities that need staff.
Okay, Mr. Qazi, where would you like to begin? I'd like to hear your responses as well.
On the staffing side, let me point out something to you that's an excellent example of collaboration between all the stakeholders. When we were getting ready to open up the COVID unit at Ciena, and it's about 70 beds, we desperately needed staff to staff this unit. Henry Ford Health Systems, we partnered with them, and they made 12 nurses, RNs, available to us. They had recently shut down a drug rehab center and whatnot, so they had this extra staff because they were looking to discharge these patients to the nursing homes, the COVID positive patients. And we were more than willing to take them because these are our loved ones. So who are we stigmatizing? The healthcare workers? Absolutely not. They are putting their lives on line. So we're all in it as partners and collaborators, starting from the state. The city of Detroit, as I mentioned, has been a wonderful partnership with the health department. We're in touch with Denise on pretty much on a daily basis. So we're communicating. She knows our challenges. She knows how we're dealing with those challenges. And so it's been a good collaboration. And I think we're making significant progress.
Do you see yourself?
And you should mention, you paid a premium to the workers who work the
Yes.
COVID unit to make sure they were properly staffed.
Absolutely. So what we did is we're paying extra wages all across the board to all the nurses and the frontline staff, and then we introduced something called a hero pay and then a superhero pay. So all the employees that are working in these COVID units, they are making substantially more money to incentivize them to come to work. But there is no amount of money that we could pay to convince someone to put their life online. So I can't say enough and emphasize enough that we all really need to really give a shout out to the healthcare workers, particularly one in the nursing homes. And as you might know, a few weeks back, CDC came up with the guidelines that the family members could not visit their loved ones, which was a very challenging situation, you know. So now these caregivers, not only that they're taking care of their loved ones, now they are the quote unquote the family to them. And there's no social distancing when you have to give somebody a bath and you have to feed them. So these are true heroes, the ones who are working in the nursing homes. And so if anything, I think they are the ones. And we're doing whatever we can as the owners and the operators. We're providing anything and everything. My only question to my staff is, what is it that you need? I'm here to support you. I'm here to help you. And I don't mind reaching out to the mayor's office or the governor's office when we need help.
Do you see yourself tapping into a pool of healthcare professionals? We've seen layoffs by the hundreds and thousands here in Metro Detroit. Big news yesterday came from Beaumont Hospital where they're laying off people by the thousands. So there would be no shortage of pools of those types of employees. Do you see yourself ever needing to tap into those?
We are certainly looking forward to hiring more nurses, and I think there might be opportunities because there are certainly, like you said, some of the hospital systems, they're not back to their normal routine business. As you know, a lot of them can't do elective surgeries and all that. So they do have some staff, and as I mentioned, Henry Ford, we partnered with them, and we're looking forward to getting some more nurses from the other health systems as they become available.
And the last question I have, I believe the mayor said that you operate Regency on Shane.
Yes.
Do you also have Regency in Livonia?
Yes, that's one of them.
And that's where there were 15 deaths a week and a half ago. Is that correct?
Unfortunately, that's correct. Yep.
Any particular reason why that number of deaths in one facility? It's been 10, 11, 12 days ago now. What caused that to be such a hot spot?
It really is very difficult to sort of, pinpoint exactly, because it could start with one person, right? One employee who, because there was lack of testing 3 weeks ago, that someone comes in and infects somebody, and then it's unfortunately it's an infection that's very spreads very quickly, and there's really no way of knowing exactly from who to who and how it went. The best we can do is to contain it, and I believe the availability of PPE has made a big difference in doing so.
Has that number changed? Is it still 15?
To the best of my knowledge, that was the number, but I can't tell you exactly the right number at this point. I can get it for you.
Okay, because that was several days ago. And did you run into any particular staffing shortage there with that high number?
Staffing is it's like I said, in healthcare, and particularly when you have a pandemic, right? You have challenges. Sometimes staff is not getting there. But we are staffed well. We do have, at some time, there could be a shift where there's, we could use more hands, certainly. But we've gone all out. We're using agency. We're paying high wages. We're reaching out to nursing schools. We've done everything we could, and we are. We had staff come all the way from Monroe to take care of patients in Canton and Livonia over the weekend. So we're managing and doing whatever we can on all ends.
Okay, I'm going to step away from the mic, but I'm going to leave you my card. You can pick it up afterward. If you could have someone get back with me on the number of positive cases you've had at Regency in Livonia, and if that number has ticked up from 15.
Sure.
Thank you very much.
Thank you.
Okay, Mr. Mayor, we've got a number of questions. Some of them are off the nursing home topic, so I'm going to get those done out of the way, then we can get back to the nursing homes. Regarding the Abbott machines, you'd mentioned the deal with Abbott, and Crane's Detroit business is wanting to know what's the status of the new machines.
The other 10 machines arrived this morning, and so we'll be putting them out tomorrow.
From the Metro Times, how many tests do you think will be needed before Detroit's economy or the state's economy will be able to ramp up again?
It's going to go in phases, and so I think you're going to see outdoor work, construction work, things that are more easily done in a medically safe way go earlier. I think you'll see some offices where people are spaced out go relatively early. I think you'll see baseball, football games, theaters, sit-down restaurants be later. And so what you'll have to do, if I have my way, and ultimately it isn't my decision, except for the 9,000 city employees, but I can tell you what I'm going to do for the city employees is before we call them back, everybody is going to be tested. And anytime there's any sign of a symptom, if you're on the job, because just because you get tested negative, you come back to work, doesn't mean you don't get it from a relative a week later. They're immediately going to go for the 15-minute test. I think you're going to see employers in this city do that the same way. In fact, a lot of the calls that we are getting from employers to go over to the fairgrounds right now are some companies who are about to reopen to do essential work. So I don't know what the number will be. I know I have 10,000 people that we want to get tested right now from private employers, and you're going to see it open, I think, slowly but steadily in the coming weeks and months, and we just need to do the testing ahead of the phased opening.
Okay. A couple of reporters have asked if we have an updated number on how many beds are occupied at TCF.
Yeah, 17.
17.
I was over there this morning and they had 17.
Okay. Regarding small business funds, the DEGC program and TechTown, both of their programs have expired as far as the ability to distribute any more funds because they're all signed up.
Right.
WWJ wants to know if you've got any thoughts in terms of what that means for the remaining small businesses or what other assistance might be made available.
So right now the next focus is going to be Congress yesterday started to move on the extension of the so-called PPP. There were a lot of small businesses that didn't get qualified. You saw the stories about the issues at Comerica Bank that were covered today, which is something we've been well aware of. And so we're going to turn a lot of attention right now to making sure that small businesses who didn't get through the system before the money ran out in the last phase, we need to make sure that those folks can get their money. And then we're continuing to accept donations on the grant program. But right now, there's a whole lot of businesses in this town that got shut out of the first wave of the PPP. We got to make sure they get their money, and that'll be our focus right now.
Okay. Last off-topic question is, Mayor, do you have any thoughts on whether the annual fireworks show should go forward this year?
I can't imagine, certainly not on the schedule. We haven't had any conversation about it, but there's no way that anybody's going to allow crowds. Certainly I'm not going to allow crowds of that size on the original schedule. Could it be done later in the summer or the fall? It doesn't have to go to the year. We haven't focused on that yet, but it certainly won't be on the regular schedule.
Okay. And from Karen Drew at Channel 4, back over to nursing homes now. She wants to know what the city's response is to what some healthcare workers are telling them, that nursing homes are not being fully forthcoming when it comes to their COVID cases.
Again, we are having no trouble getting the information, but we don't have to rely on anybody. We are literally testing every single resident of every nursing home ourselves. We know exactly how many are positive and how many are negative. And the information on deaths really comes from the hospitals, because in most cases the nursing home patient gets transferred to the hospital. Hospital reports that patient as a death. It takes a while to track the data back, and as I indicated, we're going to report that publicly. Now, what information is being communicated from the nursing home to an individual, I don't know, but I think in light of the governor's order in the last couple days, that will likely improve. I'm glad the governor addressed it.
Okay, and a second question from Karen Drew is that nursing homes are saying that they don't have the space for all of the quarantined patients, so could they be moved to the TCF Center?
No, you could not. The TCF Center is for patients who have been treated in a hospital and are getting better and a transition on the way home. So that's the whole protocol at the TCF Center. You would not send somebody directly from a nursing home to the TCF Center. That would not be an appropriate level of care. So I don't normally speak for the Army Corps of Engineers, but I'm quite certain that's their answer.
Okay, I think Ms. Fair addressed this partially earlier. Cranes Detroit business is wanting to know what's the impact of COVID-19 been on other care facilities outside of the nursing home umbrella, such as adult foster care facilities, assisted care facilities, and other long-term facilities, and secondarily, are there plans for testing?
Denise?
Sure, so that's our next phase. Right now our strategy has been primarily focused on the nursing homes, but now that we have the CDC here, they will help us with that strategy for our long-term care facilities. That does include our skilled nursing facilities, as well as any other facilities outside of the nursing homes.
A specific question for Mr. Qazi from Cranes Detroit Business. Has Ciena been converting space for subacute care units to take discharged hospital patients or their own recovering patients?
Yes. I mean, right now there's not a lot of subacute business going on because most of the subacute patients are the ones who've had, like, selective elective surgeries, hip replacement, knee replacements. All of that is right now on a standstill. So we have plenty of availability. Rest assured, we have, now that we've established these units within our buildings, there are plenty of room, there are beds available within these units that can accommodate. So we're not, certainly it's a timing thing as patients are recovering from COVID at the hospital. We have to make sure that the testing is done and that and within the nursing home, anybody that comes in, we suspect, we keep them on observation, quarantine, and then we get them tested. So we keep them in isolation. So I think, the situation on ground has tremendously improved in the 2 or 3 weeks since some of those questions were coming up.
Okay. From the Detroit Free Press, I think this was partially addressed earlier, but how specifically are the results of COVID-19 tests at nursing homes being communicated to family and other residents? And are they being told the total number of cases and deaths at the facility, or just that there are some?
Certainly there are requirements when it comes to patient-specific information. There are privacy issues and there are HIPAA laws, and so we have to abide by all those. But beyond that now, since the governor came up with she came up with this strategy through the executive order that now the state is divided in 5 hubs, and Detroit is one of the hub. So under that hub, these units are operating now. So the nursing homes are required to, on a daily basis, report any of the COVID positive patients.
Okay, and one question from the Detroit News having to do with meal service at the nursing homes. Is anything being done for social distancing in terms of people congregating for meals?
I'm sorry, what was that?
So are you keeping individuals separate or during meal service, or are they being allowed to congregate?
Yeah, there is no more communal dining, so there are a lot of rules right now in place to our first and foremost obligation is and priority is to keep our residents healthy and also our staff healthy.
So are you serving patients in their rooms?
I'm sorry?
Are you serving patients meals in their rooms?
Yes.
Okay.
So there's no more communal dining, and so there's less and less interaction. So whatever is done, and then the staff has now the PPEs, as I mentioned earlier. They have the masks, they have the gowns, they have the gloves, they have everything that they need to take care of the patient. Certainly we need more of it, and that's where we are communicating with the health department to get us more PPEs, and we are told that there's more on the way. So I feel pretty comfortable that we shouldn't have any issues as far as that goes.
Okay, and I believe this is the last question. It's another follow-up for Ms. Fair. I don't know if you mentioned this particular category or not, but the Free Press wants to know if the city also has plans to test residents at senior buildings, senior apartment buildings.
Yeah, so I think that could be a part of our strategy. Again, I'm looking to the CDC to provide us with some guidance on next steps. I think that would definitely be appropriate.
So we are going to go in order where the science tells us to go. So the places at which the spread is occurring greatest, we're going to go in that order. And with the CDC here, whether it's a skilled nursing center, whether it's a mental health residential facility, whether it's a rehab center, whether it's a senior center, we are going to go with the CDC's guidance in order of the greatest need.
Okay, that was the last question.
All right, thank you all very much.
怎么又晚了？
这诊所太远了，这里多开几间就好了。
政府里需要有我们的人，需求才会被听到。
哎，你这……哎，你们两个都对，可光说有什么用呢？填好2020年的人口普查，就可以协助公共资金的分配，比如地方医疗，更多的政府席位。想要给自己发声啊，赶紧上网填，打电话也行。
请上2020census.gov 完成普查。